Well, welcome to the Better Breathers Club of BC. This is a monthly support group. It is fully supported by the BC Lung Foundation. So, a big thank you to the BC Lung Foundation and provided by Poplar Pulmonary Wellness. We would like to do a quick land acknowledgement. So, the lands on which we live, work, and play are the unceded ancestral territories of the Coast Salish people, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And if you'd like to pop in the chat, if you wanted to write the lands on which you live, work, and play, we'd love to hear from you. And we like to create a safe space for our Better Breathers Club of BC, where everyone is free to share their thoughts, values, and opinions and ask questions without fear of judgment. So we thank everyone in advance for helping to create that safe space for us all. And a reminder that all of the information that we share here is for educational purposes only. It doesn't replace professional medical advice from your healthcare provider. And we have a new program that has just started up. It's the Better Breathers Pickleball program. This is an in-person program. It's in Burnaby, BC. It's twice a month. It's super fun, and it is designed specifically for those living with chronic lung conditions and a support person. So you're allowed to bring somebody in to join in the play and whatnot. So please do reach out to us. We'll leave our contact information coming up. If you have any questions or you're looking to join, again, this program is fully sponsored by the BC Lung Foundation. And if you're looking for more or looking for some guidance with the programs that we do provide, please do reach out. We've got the phone number and email address here, and you can get a free 15-minute phone call or a virtual appointment, and we can help to guide you to our other services that we offer, including individualized respiratory care plans. And so if you have any questions about the Zoom room, please do let us know right now if that's okay. Just raise your hand. You can always change your view on your screen to speaker view or gallery view. There's usually, if you tap the screen, it'll pop up, or if you're on a computer, there'll be a view thing in the top right corner. So without further ado, let's get cozy. And I would like to welcome Kate Larkin as our guest speaker for today. So Kate has been a registered respiratory therapist since 2012. She's worked in acute care and now she works in primary care and community. She is the patient educator at the NTM clinic for Vancouver Coastal Health. She is also an instructor here at Poplar for our pulmonary rehabilitation program and the Harmonicas for Health and Happiness program. Kate is a very active outdoors enthusiast, loves to spend time in nature. We always get to hear her adventure stories. So thank you, Kate, for joining us. I'll hand over to you. Just let me know when you're ready to flip between the sides.
Yeah, sure. Well, yeah, bring up the first slide. Good afternoon, everyone. Happy to be here speaking with and seeing you all this afternoon. Yeah, so this is we're going to be talking about NTM, which is short for Non-Tuberculous Mycobacteria, which is a bit of a mouthful, which is why we shorten it to NTM. And just a little caveat, I'll be referring to NTM pulmonary disease most of the time, but just calling that NTM as well. And then we'll talk a bit about bronchiectasis as well, which is a chronic lung condition, and we'll see how it relates to NTM through our discussion today. So things that I'd like to get to today. First, we'll talk about what is NTM. It's something that not a lot of people have heard about, and I will admit, until I started working at the NTM clinic, I didn't really know much about it either. So you can come along that journey with me today. And then we'll talk about who will get NTM, and by that I mean NTM pulmonary disease specifically. What the symptoms might look like, how it gets diagnosed, and how it gets treated. Then we'll move into our discussion about bronchiectasis and how that ties in to our discussion about NTM, and then talking about treatments for bronchiectasis and specifically airway clearance and like kind of some action items that you may want to consider. So starting off with what is NTM? Well, NTM, like I said, stands for Non-Tuberculous Mycobacteria, and that is it's a group of bacteria, over 200 different species that all kind of fit into this umbrella. And they're bacteria that are found in our environment here in the soil and in the water. And I don't just mean here in British Columbia, I mean it's really kind of all over the world. And so something to know that's important, I think, or that you might like to know, is that it's not contagious. It's a bacterial disease, so it's not transmissible between people like a virus would be, like a cold or a flu. So if you're around someone that has NTM pulmonary disease, you're not going to catch it from them or pass it on to someone else. And because it's in our environment, it's in the soil and the water, like I said, everyone gets exposed to it. And so we know that exposure does not equal infection. And so you can be what's called colonized with the bacteria, and that you've been exposed to it. It might be present in your body, but it's not making you sick. And so like I said, when we talk about who gets NTM, that's kind of when we'll get into when exposure does turn into infection. And that's, I think, on our next slide. Or maybe actually the one after that. We'll talk about this here. So we can split NTM infection into NTM pulmonary disease, which is what our main focus will be on today's talk. But you can also have an extrapulmonary or outside of the lung infection with an NTM bacteria. So the pulmonary disease is caused by inhaling the NTM bacteria. That's this kind of the most simple way to put it. And that's through aerosolized water, so mist or like small water particles in the air. And that's when can even be when you're having a hot shower or you're in a hot tub or a sauna environment. And then through, like I said, in the soil, so disturbed soil, like if you were gardening, say, and even if the soil is quite dry and it's releasing kind of dust particles, soil particles as you're working with it, and you breathe it in, that can be another source of exposure to NTM bacteria. And then extrapulmonary infections, so that can include like in your bone or your skin or other soft tissue in your body. So we know some sources of infection can be like a surgical site or an open wound. That's where the bacteria can get in. And then also through contaminated instruments or implants, just like other things you can get when you're having a operation and they don't have properly clean instruments. And it's been known to be transmitted through contaminated tattoo ink. So if anyone in here is thinking about getting a tattoo soon, you can be aware of that as well. All right. So now that we know a bit more about NTM, who will end up, who is more likely or has a higher susceptibility to getting NTM pulmonary disease. And so these are all just higher risk factors. It doesn't necessarily mean that that you will get NTM pulmonary disease, just to be clear about that. So typically we see it in folks that are of older age, and also lower on the BMI scale. And I don't think that there's any particular reason known, especially for the lower BMI part of it. It's just that seems to be a common body type that we see, especially a lot of that in our clinic. So I would agree with that assessment. Someone who is immunocompromised or has immunodeficiency, so weakened immune system or an autoimmune condition. And so some examples of that would be an autoimmune condition like rheumatoid arthritis or HIV. And then If your immune system is suppressed, maybe by medication that you're taking, like on chemotherapy, and also oral steroids, which I know is something that may come up in this population, folks that take steroids to help manage their lung condition. Um, but I would say with the caveat there that when you're taking a course of steroids, maybe for a flare-up of your lung condition, I don't think this would fall into the category of putting you at risk for NTM pulmonary disease. It's more if you're chronically on oral steroids. And then kind of another big category of folks that are susceptible to NTM pulmonary disease are folks that already have a pre-existing lung condition. And so some examples in there are COPD, so the chronic bronchitis and emphysema folks, having bronchiectasis, cystic fibrosis, and other genetic lung conditions, having previous lung condition or lung infections, pardon me, that can, result in lung damage over time, will make you more susceptible to having NTM pulmonary disease. And then lastly, having any sort of mucociliary impairment, like primary cilia dyskinesia. And that's a lot of big words there, but we have our cilia in our lungs, the little hairs in the lining of our airways that help clear our mucus out by kind of pushing it up and out. And when those are not functioning properly, we get trapped mucus. And that is a great place for infections and bacteria to grow. So if your lungs are not clearing themselves out properly, then that makes you prone to a lung infection. All right. So we've covered what is NTM, who gets NTM, and now what are the symptoms that you might experience if you do have NTM pulmonary disease. And so you'll see this list here and think, well, these are kind of a lot of similar non-specific symptoms that a lot of lung conditions have. And so you'd be right, based on symptoms alone, it's hard to differentiate these are NTM pulmonary disease from a lot of other ones that you know about, like COPD and pulmonary fibrosis and all that stuff. So, but these are the more common ones. So having a cough, a regular cough, and that may be with or without sputum production. Having fevers and night sweats, experiencing like unintentional weight loss, and that can be with or without loss of appetite as well. If you're experiencing hemoptysis, and that's when that's coughing up blood, or dyspnea, which is shortness of breath. Shortness of breath on when you're exerting yourself or even at rest, and that's kind of when you experience a change in that. So if you're experiencing more shortness of breath than usual, than you used to, that's something to pay attention to. And also just general fatigue, like when you have any other illness where you feel a bit more tired. So when you're experiencing those symptoms, certainly worth paying attention to. And then hopefully then you get some more investigation done and we can move forward to possibly getting a diagnosis. And so how we go about diagnosing NTM pulmonary disease is through imaging. So a CT scan of your chest, and that can show changes in the lungs. Some of the NTM bacteria are known to when it's progressed, can cause cavities or lesions in the lungs, which can be seen on the CT scan. Also, just an abnormal widening of the airways is another kind of sign there might be an infection happening in there. And so between the CT chest, maybe having some infectious changes shown on there, and if you were to produce a sample of your sputum, and they would test that. So we would either get you to cough up into a little cup, and we send that into the lab, and they test it for any kind of bacterial growth. And if you have at least one positive sputum sample that's growing a species of NTM, and you have changes on your CT chest, then we can usually move forward with a diagnosis of NTM pulmonary disease. So now you possibly have been diagnosed with NTM pulmonary disease. So how do we go about treating it? And I think the maybe surprising answer might be that we don't always. It's possible to have a to be sorry, to have the NTM bacteria in your lungs, like so how you'd have a positive growth in your sputum culture, but you're not really experiencing any symptoms and your quality of life is not really being affected. That may be a situation where we kind of just monitor you and don't do any treatment for the time being. And that is because the treatment itself can be quite um, can affect your quality of life even more than the disease itself. NTM is, and actually what I didn't say at the beginning, which I should have, but NTM bacteria are in the same family as tuberculosis and leprosy, the bacteria that cause those diseases. And so they're quite they're quite tough bacteria and difficult to kill and completely eradicate from your body. And so to treat, if we do decide to treat a patient for NTM pulmonary disease, it's with at least 3, sometimes 4 antibiotics at the same time for at least a year. And that is giving antibiotics in several different forms, either oral, like pills or tablets, intravenous, like through an IV line, and also inhaled with a nebulizer. And that can be kind of any combination of those, depending on what species of NTM we're trying to treat. And so these, several antibiotics at one time, and they all have different side effects, and some of them, can be uncomfortable for patients. And so the patients that are decided to get treatment, it's carefully weighed with their quality of life versus what symptoms and maybe what lung damage they have already. And so if you make it through the 12 months on the antibiotics, even then we may not see that the bacteria are completely gone from your lungs or from your sputum. So we continue to test your sputum all the way through, to test for presence of the bacteria and also just how much is in your lungs. And so we may be able to reduce the amount of bacteria, but not completely clear it. And so that is the difficult thing about treating this disease. And so up at the top of that slide there, and what will kind of lead us into the next little topic of our conversation is airway clearance, and that is a big part of treatment for NTM disease, and that is why they have me at the NTM clinic, is to help educate patients on airway clearance, and that is different ways to help clear mucus out of your chest. And we know that with the lung changes seen with NTM disease and bronchiectasis, as we get into that, it is more difficult to clear mucus out of your lungs. And so there's some practices that you can implement to make that easier for yourself. And I guess then we can go on to the next slide there. Thanks. And we'll talk a little bit about bronchiectasis now. And so the reason why we kind of tie these two topics together, NTM pulmonary disease and bronchiectasis, is that it's kind of like a chicken and the egg scenario, where if you have bronchiectasis, and I'll explain how you may get that in a moment, that can make you more susceptible to having NTM pulmonary disease. But also you can have NTM pulmonary disease and that can lead you to having bronchiectasis. It can kind of go either way. And so that's how these tie in together. But bronchiectasis itself is a chronic lung condition, like COPD, pulmonary fibrosis, some of the other ones I mentioned earlier, cystic fibrosis. And it basically is it's an abnormal widening of the airways. And it gets classified as an obstructive disease. So you may have heard the terms obstructive disease and restrictive disease before. And obstructive diseases are ones that basically they call it that because it obstruct airflow. So COPD is a great example of an obstructive disease in that airflow is obstructed and harder to move that air in and out. It's hard to distinguish from COPD, actually, just symptoms are the same, pretty similar in that often have cough, mucus production, difficulty moving air, like I said, in that obstructive disease category. And so really, I think over time with advancements in kind of diagnostic tools, we've been able to differentiate COPD and bronchiectasis a bit more now. And so it seems like bronchiectasis is showing up a bit more in patient population, at least from my perspective. And I think that's because we're becoming a bit more aware of it and able to differentiate it from COPD a bit better now. And because of that, then, we treat those diseases differently. And so causes of bronchiectasis can be infectious. So like I said, the NTM, but also having pneumonia or several pneumonias over a period of time. Can also be idiopathic, and that's our fancy medical word for we don't know where it came from. The cause is unknown. And then also it's closely associated with cystic fibrosis. So having that genetic lung condition, which, often you have several lung infections with cystic fibrosis that then can lead you to having the damage that turns into bronchiectasis. And so there's this nice little circular graphic here that I like that can kind of help explain the kind of the cycle that you can get into with bronchiectasis. And so I don't have a pointer. Maybe if you want to use your mouse there, Tina, if we start with the bacterial infection and colonization portion on the graphic. And then when you have a bacterial infection, right, then we have the next arrow will take us over. We get the inflammation in our lungs. That inflammation is what causes kind of airway destruction, widening of those airways in an abnormal way. And then when we get those dilated or widened airways, those develop pouches that can trap mucus, and then bacteria like to live and thrive in that mucus. And so that's why airway clearance is such an important part of the treatment for this condition. And so, if we don't mind, sorry. So yes, you have the abnormal mucus clearance, and then that cycle continues. So you have mucus trapped in your lung where the bacteria likes to grow, and that can lead to making you susceptible for further bacterial infections. And so on, the cycle continues. You get another infection, more lung damage, difficulty clearing your mucus, and so on. So if we could go maybe into the next slide, and I have another visual for you for if you're a more picture type learner. We have an example of lungs here with bronchiectasis. So just to kind of orient you here, so on the left side of that image there is a picture of someone's chest with showing their lungs on the inside there. If we were to take a little cross section of that lung and we would go into the top image there, we have a healthy looking airway. It's of normal width. The airway wall is nice and thin, and we can see nice relaxed muscles around that airway. If you were to take a cross section from lower down in that lung, we would go into the other box there, and that's an airway with bronchiectasis. And you can see it's wider than the healthier one. It has lots of thick and sticky mucus in there that's not really coming out. and the airway wall is quite thick from scarring and inflammation. So let's move into the next slide there, and we'll talk about how to deal with bronchiectasis. And so how we treat bronchiectasis is interrupting that cycle that I went through before, where that red X is there. So we want to help with that mucus clearance to then prevent further bacterial infection and colonization. That's where the airway clearance fits into that cycle. We hopefully break that cycle by doing this airway clearance. So I have a list here of a few ways that you can perform airway clearance. And we'll kind of start with the most simple and we'll work our way up through into different steps or sort of higher levels of treatment, I guess you could say. So the first is active cycle of breathing, and that is purposeful deep breathing and coughing to encourage upward movement of mucus. And if you've attended previous Better Breather Club discussions, I think that topic has been discussed already. So I won't get into that too much in detail today. The other method is using what's called an OPEP device. And actually, if you don't mind going to the next slide, Tina, here, and then I'll just have a picture here. So this is an example of that, and this one is called an aerobica. And so this OPEP is oscillatory positive expiratory pressure. So again, it's a bit of a mouthful, but it's a device that provides resistance as you breathe out through it. It helps hold open the airways and also provides some fluttering and vibration. Tina's holding one up for you there, and helps shake loose the mucus as you're breathing out. So it helps make it then easier for you to cough it out. This aerobica is one example and the one that we use the most often because it's the most accessible in terms of availability and price. Typically around $90 from most pharmacies, and it's something that you don't need a prescription for. You can just go and get one if you think that it would be helpful for you. So let's go back up to the treatment slide. The next on this list here, nebulized hypertonic saline, something that I coach patients through at the clinic. If you're using an aerobica or some other OPEP device, and it's finding it's not quite working well for you, you can kind of step it up once more and start using a nebulizer. And so if we can go 2 slides in now, we have a picture of that here. So that's a device that basically it turns liquid into a mist or an aerosolized mist so that you can breathe it in. And so we use this kind of device for medications like the inhaled antibiotics, like I mentioned before, as our NTM treatment, but also for the hypertonic saline for airway clearance. And that means hypertonic is just salty water, basically. And so it's more salty than the salt content in our body. And so how that works, we know that water likes to move towards salt. So when you breathe in a really salty solution, it draws water into your airways and thins out the mucus and then makes it easy for you to cough and clear it up. And that actually we find that it can be quite beneficial for a lot of patients. So we can go back up to the treatment slide again. And so then other things that are helpful for airway clearance, getting regular exercise, aerobic especially, something that gets you breathing deeply, helps facilitate mucus movement, and staying properly hydrated keeps the mucus nice and thin. Yeah, and so on top of airway clearance, that is kind of the preferred treatment for bronchiectasis and is preferred for a lot of patients as well because it is a non-medicated option. I hear from a lot of people that they're trying to reduce the amount of medications they're taking. They don't want to have another one added in. And so any of these airway clearance practices, they're non-medicated, and that is, I think, a big draw for a lot of people. So antibiotics for flare-ups of your bronchiectasis as well, similar to COPD or any other chronic lung condition where you kind of have an action plan, prescriptions ready to go for you. You can have a bronchiectasis action plan, pre-prescribed antibiotics, so that if you are experiencing symptoms of a flare-up, increased mucus production, change in sputum color, maybe fevers or fatigue, you can consider starting antibiotics to nip that flare-up in the bud. And lastly, to kind of tie everything in together here, part of bronchiectasis treatment, if perhaps you're worried about contracting NTM pulmonary disease or you're already dealing with NTM pulmonary disease, is to limit your NTM exposure. And so I'll just kind of work through that a little bit, and then that'll be the end. And then we can open up for some questions if you have any. But ways to limit your exposure to NTM bacteria. Certainly staying up to date with your vaccines, just like with any chronic condition, is a good idea. Continuing to practice good hand washing, avoiding contact with sick people, and then cleaning your shower heads and faucets. What's recommended is about monthly. So that would be like removing the faucet, shower head, cleaning it in a solution like CLR, and then replacing the shower head or faucet and doing that about every month. It's also suggested you can increase the temperature of your hot water heater if that's something that is possible on your particular device, up to 55 degrees Celsius, and that makes it a more hostile environment and less likely for the NTM bacteria to grow in that stagnant water. Changing out water filters regularly as recommend or at the recommended timing by the manufacturer, and actually staying away from carbon-based water filters that are usually found like in like brands like Brita that you might have in your fridge, just because water kind of will stay stagnant in those filters and in that environment can be a kind of like growth medium for bacteria. And then when it relates to working with dirt, so you can wear a dust mask when you're gardening or dampen the soil that you're working with before you start gardening, just to limit the amount of dust that's coming up around your face when you're gardening. And then kind of be mindful of how much you're using a hot tub or a sauna, that kind of thing, anything that has the aerosolized water that you might be breathing in. That's quite a long list, but some things to keep in mind when kind of keeping your environment clean. Yeah, so that is kind of everything I wanted to go over with you all today. So we can leave it there, but happy to take any questions that might have come up.
Awesome. Okay, just before we end off, I'm just gonna fast forward. I got two slides and then we'll open the floor for discussion. So thank you everybody for listening in on this amazing talk. Thank you, Kate. Oh, so much information. Our next one is coming up next month, May 13th at 2 o'clock Pacific. That is with Prem. He is from the BC Lung Foundation and he's going to be talking about air quality. And that was also sponsored by the BC Lung Foundation. So a big thank you to them for sponsoring this talk. And if you're looking for more, please do join us in the Poplar community. It's a free online breathing community. So you can check in with people like your speakers, Jenna and myself. We share the links from our talks there. We share the videos there and plenty of other resources. You can also connect with each other there through the big chat and see past recordings of other Better Breathers Clubs of BC in case you happen to miss those. So we will pop that into the chat as well.
We also have a great bronchial hygiene section, which Kate reviewed for us. So it has some great resources for mucus clearance that she talked about today. So I will pop those links in the chat right now.
All right. Thanks, everybody. So if you're joining us online, check the links below the video to find all of that information.